In this video, we will talk about the complications of bariatric surgery. Whenever a patient comes to us, I think the biggest concern before they actually take the decision about going in for surgery is about the complications and especially the immediate surgical complications that they can have during bariatric surgery. And what I would like to say here is that bariatric surgery, since the advent of laparoscopy, has become very safe. The rate of complications is quite low. It would be less than 1 to 2%. It is as safe as any other laparoscopic surgery, say like a laparoscopic gallbladder removal or a knee replacement surgery. So the complication rate is similar to all these surgeries. When we talk about any bariatric surgery, which is basically a gastrointestinal surgery, there are certain specific complications that can happen, and if you are researching on the internet, you will come across terms like leakage or terms like hemorrhage. Definitely, whenever we are cutting a part of the GI tract, stitching it back or stapling it, there can be a technical risk of having a leak from there, but this risk is very, very small. And we also have risk factors for certain kind of patients who are more prone to having these complications. So anybody with a very high weight or a very high BMI would be more prone to have complications. Anyone who is an uncontrolled diabetic would definitely be at a higher risk of having complications. A person with older age, if the surgery turns out to be very difficult due to previous adhesions or something like that, then definitely the risk of complications is higher than any other person. However, the risks can be minimized by proper preparation. The other complications can be bleeding. So bleeding is something which can happen during any surgery. In the normal course, during any bariatric surgery, we don't have bleeding more than say 20 to 30 or maximum 50 ml of blood. In rare cases, there can be hemorrhage. This can be tackled either conservatively or surgically depending upon the clinical scenario. And these are the two main surgical complications which can happen immediately after surgery. There is another complication called as deep vein thrombosis, which is commonly seen in patients with obesity. And this is basically clotting of blood in the veins, deep veins of the legs. And most pediatric units would actually take a lot of precautions for prevention of this, which would include giving blood thinner injections, which would include giving calf pumps, compression stockings, and also making the patient walk as early as possible. There can also be some anesthesia-related complications, but overall, the risk of complications is low. And the trick is actually to prepare the patient really well. And once the preparation is well from the patient side and the team side, the chances of having complications can be quite low. Thank you very much.